If you're building your ABA company and you're tired of guessing, this is for you. We built the BACB blueprint to give you real structure, systems, and support without the fluff. Details are in the description.
How can large language model chatbots solve your top ABA business problems? We've got Jay Gupta and Joshua Farrow here from Neuromnia. And as we were just talking about, we have to use AI if we're going to compete. It's like a computer in the 90s and the early 2000s. You can run your business without it. You just can't compete. And as we're adopting these new technologies, these new ways of doing things, we have to make sure that, number one, we're doing it responsibly. And number two, that we're actually getting good use out of it and getting what we need from those investments of our time and money, where it translates into better work environments, more efficient, effective work environments, and better outcomes for our clients. So this is what Neuromnia has focused on, getting rid of billing issues, denials, compliance headache. These are things that every ABA therapy company deals with universally. And we're going to learn about how some AI-powered workflows can streamline our systems at our ABA companies. So with that, we've got Jay Gupta, Joshua Farrow here to show us their AI, which is hosted in Azure. It is secure. It is safe for HIPAA. And I love the way that they have everything designed. So with that, Jay, take it away.
Thank you, Derek. Hi, everyone. I would like to thank everyone who has joined us today. So I'm Jay Gupta. I'm an AI/ML engineer by training, and Josh Farrow here, who is a BCBA with 15 plus years of experience under his belt. We make an interesting duo because we come from very different backgrounds that never converged otherwise. That's one of the reasons why you're listening to us today, because we can then bridge the gap between ABA and AI/ML, which is kind of a black box even to this day. We're trying to construe more about these language models and generative AI in general. A little bit about my personal journey. I'm an autism dad, and I saw firsthand how valuable your time as ABA providers is and how much it gets consumed by admin challengers and instead of client care. We analyzed over 1,500 posts in Derek's book group to identify the biggest pain points that are stealing your time and money. And today we're focused on 3 specific issues with immediate solutions. So in the next hour, Josh will walk you through exactly how LLM chatbots can solve your pressing business problems through 3 practical demonstrations. First one will be a multi-pair chaos, which is uploading pair documents and getting clear answers that can save hours of phone calls and manual cross-checks. The second one will be denied claims to approvals, particularly for a specific use case like daily living skills that insurers often reject as not medically necessary. So that helps you reclaim thousands in revenues. Of course, as we've noted, about 65% of denied claims never get resubmitted. And the third one is the most interesting, which is the compliance documentation. How do you create customized employee handbooks and client service agreements that can save startups upward of $2,000 on consultant fees? And all this can just happen with some mere $20 LLM subscription. So some street smart AI skills to be imparted here. What you'll take away today is immediately actionable. The practical skills you will learn today can immediately free up time and resources in your practice, letting you focus more on what really matters, providing quality care to your client. With that, I'll hand it over to Josh, who's going to dive right into our first demonstration on tackling multi-pair chaos. Take it away, Josh.
Yeah. Well, so we have right away, actually. So we're gonna really hook you guys in. You know, Jay mentioned, how are you gonna save? You're gonna save thousands of dollars on, you know, paying for those custom documents, right? I'm sure some of you guys maybe have looked into that or heard of that. You know, you're usually paying $400 or $500 for like a custom employee handbook or, you know, custom policies. And so what we'll do first is just really quickly show you, how can you tackle that? And then we'll circle back around to some of the finer points of, how do you use LLMs successfully? How do you prompt them? How do you make sure they're giving you the right answers and review those answers effectively? Okay. So first off, how do we save this money? Okay. You know as well as I do, there's different employee handbooks online. I think these are awesome. No shade against these, although they are expensive, and these employee handbooks are not really customized unless you pay for that customization. So what we're going to do first is just show you that just from one of these freely available table of contents, which are usually given by these consultant agencies to show what they cover. A lot of times they're marketed as, this template has successfully passed the Medicaid and Optum audits, right? So if it has all this, and then if you upload your payer audit documentation, which I'll show you how to do shortly, you're gonna presumably get something that is gonna pass the audits as also. Okay, so what I've done here, I've set up a lot of the examples today. I want it to be seamless, so I have set some of these up ahead of time. You can see here I've pasted in into ChatGPT. Okay, if you just go to chatgpt.com, you could try this as well. You can paste one of these tables of contents in here, and then ask it to do research. Okay, GPT is not the only one that can do research. We also have, I'll show you a couple other models that can do this research for you, but you'll see after you paste this table of contents, it asks for some clarification. It asks for, what do I prioritize? Are you looking for general or legal or regulatory requirements? I did ask, specifically for this to be written and researched for Indiana ABA therapy agencies. You'd want to, obviously replace your state, right? And then so you're going to answer some of these questions. Tell it the important points. I want the format to be in a structured doc, okay? And then you can see here, this research took 19 minutes. Okay, and GPT does some really thorough research. But again, other models will do this. It might take 3 or 4 minutes. It might take 6 or 7. You can actually tell it to go deeper, and it'll spend more time. You can see it looked at 22 sources, and if we wanted to read through over here, for the sake of time today, I'm not going to read all this, but you can see it's going and actually reading the Indiana government website, looking for specific, professional license requirements for behavior analysts, HIPAA compliance and Medicaid documentation standards, etc. Okay, and then it's going to go ahead and format all this in a very lengthy report. And I'm just going to scroll down here and show you how long this is. It does have details on every single thing in the table of contents. And this was just a research query, right? So this isn't the actual document yet. We told it to research first, and we'll talk about why that's important, but I just want you to see how thorough this is. And it has citations, and this is becoming, very commonplace again across multiple models. Like Perplexity, Grok also does this. And so let's go down to the bottom of this and see what the next prompt is, because we want to take this and use it, right? So now create the required policies. It's done all the research. It knows it's for Indiana. Now I want it to just start with the first 5 policies and create them, okay? And so we get a new hire checklist. We're going to need to go through and review this, and make sure that we agree with it all. Maybe even compare it to a reference document or something. But you can see this is extremely thorough. We have an employee direct deposit policy, okay? We have an offer letter and a simple offer letter template. Okay, so I hope this kind of whets your appetite for what we'll go into today. I'm not going to go through all of this. You guys can try it on your own, but I just want you to see how powerful these models have gotten, and that they're not just BSing. Like, they're going and reading websites now. And yeah. So with that said, let me go on to the next slide. We'll get back over to our thing. So what's the point, right? So why are we learning about this today? You can spend $20 a month. That's usually the cost for OpenAI's model, or Grok, or Claude, and you can use that to do spend an afternoon to save $2,000 for ABA business docs. You're also going to learn a lot more throughout the process. I could still understand, even with this said, maybe if you just don't have the time to do that, you know, it's perfectly reasonable. You can, you have $2,000 laying around to pay somebody. That's perfectly justifiable. But there's alternatives now. And I think what you can take away from this, even if you don't want to do this for the policies or the handbooks, is, you know, you can take what you're going to learn today and apply it for a lot of different business use cases. And anything you build, you'll be able to hopefully be confident to change in the future on your own. You won't need to be paying somebody else to update your documents every year. Or, and then the other thing you'll have is AI fluency, and that's an important skill. Just like how you had to learn how to Google search 20 years ago. And some people still struggle with that. You know, now using AI is a skill, you know, and I think especially as behavior analysts, we're uniquely equipped to understand and use these models. We'll talk a little bit about that too. Okay, so a little overview. Jay already covered this, but we're going to talk about LLMs first in ABA terms. Then we're going to go through those demo scenarios that Jay talked about, and then we'll do a Q&A. All right. First, what are large language models? How do they work? Okay, so they are using math, like hyperdimensional, very complex matrix math that, you know, BCBAs don't learn, quite honestly. But you could ask one of these language models, how do you work? And you can learn about that. It is not just random. You know, it is probabilistic. It's a probabilistic output given an input, but it's not random, okay? And even though every response is going to be slightly different, it's still based in what was the text, you know, what, you know, in that kind of hyperdimensional space that the LLM is using to, you know, kind of traverse the probability, you know, what's the most probable response for this person's question. You know, that's all real data that people wrote and, you know, on the internet or in books. And those, the things that are going to be weighted to the facts that you're going to get in responses are going to be weighted based on, you know, how thorough the source is, like how popular the source is, how much is it repeated. So yeah. How LLMs learn. Okay, so first there's the data collection phase. You know, you got to get all this training data together. Just like we use ABC data to analyze behavior, it uses billions of sort of ABC data points that are text. You know, this word came before this word, and then it led to this word, or this concept or thought happened, then this thought was the next thing, or this was the answer, right? And you can break it down into that kind of three-term contingency. And when a model is trained on all that, it starts to develop patterns. And this graph isn't this you know, network graph isn't exactly what, you know, if you pop open the hood of OpenAI, you're not going to see this, right? But this is a visual representation of a hyperdimensional model, which has many dimensions, right? This is only a few dimensions here, but it gives you an idea of just how complex it is, and that the AI or LLMs form different concepts, like different nodes and edges would represent different concepts and features of those concepts. You know, so it does organize information in a rational way, okay? Just like we do. All right. So how do LLMs process? So we know how LLMs learn, but how do they actually process the information? So you saw before in the example the prompt, right? The prompt was very important here. If I would have just said, you know, if I would not have given this table of contents and I just said research the necessary details for employee handbook for Indiana ABA therapy agencies, you would maybe get 90% of this. Maybe if you're lucky, you get all of it, you know, but the prompt really matters. The prompt made sure that we got every single one of these things. So that's important. You don't want to just leave it to chance. Then we have a context window, which is kind of like the working memory for the large language models. Okay, so the context window is, in this case, again, to use this example, it's everything in the conversation that's already happened. Just like we have a short-term memory or working memory, I know what I talked about on the previous slide, hopefully, right? It knows what it talked about in the previous response, and that's what we mean, or the previous response is. You know, it can do, you know, a whole thread. You will see as you use these models that if you keep going and you keep asking question after question for, you know, I don't know, 10 or 15 long responses, it'll give you a message saying this is getting too long, and that's telling you that context window is getting reached, and you want to switch over to a new thread then. All right, and then fine tuning. You've heard maybe about fine tuning these models. That would be like taking that giant graph of information, and then fine tuning it's exposing it and training to a subset of new data or a specialized domain of data like ABA, and then that narrows that graph and really reinforces the things that are necessary for that specific domain. Rather, for ABA agencies, that might mean like you upload your policies and procedures. Now, do those exist online somewhere? Probably the information is out there, but obviously the LLM wouldn't know which one are yours. And so you could prompt it all the time. You could always show it, hey, these are our policies and procedures. But fine tuning would allow you to just kind of bake that into the model itself. So you don't always need to do that. Now, an important note on all this, as we're talking about this is probably one of the most important things we'll say today. You don't want to put any PHI in these models. They are training on your data, and if you put client information in a non-HIPAA compliant model like GPT or Grok or Claude or anybody that you haven't signed a BAA with that isn't saying they're HIPAA compliant, they're going to take that information and train on it. If you say, some of them have the option to, opt out of that, but still, it's not, based on HIPAA compliant law, HIPAA compliance law, it's not okay to use those with personal health information of clients. We'll talk more about what you can do if you actually do want to put client data in there later. Okay, scenario one, the multi-payer chaos that Jay had talked about. So if you have, let's set this up real quick. So you have multiple payers, and maybe there's a private payer that's the primary, and then Medicaid secondary, and maybe you're not getting your claims paid. That you're not receiving the amount that you would expect. Okay, and that maybe the balance billing is throwing you off, or you're just not even sure about what the law is with multiple payers. The rules are, there's a lot of confusion about that from what we saw. This is actually, you'll see here a quote from the forum here in the next slide. You guys know the traditional way. If you have this, these issues with multiple payers, you're having to go consult your spreadsheets, review all the manuals, maybe make some phone calls. The LLM way to do it, hopefully the smarter way to do it, at least to try, and I think you'll be able to solve those problems and cut down on the phone calls and whatnot, is you're going to make sure it has all the context it needs, whether that's payer documents or manuals, explain the issue in detail, and then review the output closely, just like we talked about before. This is straight actually out of the ABA Business Challenges group. It was one of the users was having an issue with a client with UHC, HMO, and Medi-Cal in California. This is not medical, it's Medi-Cal as a secondary insurance. We're out of network with UHC. I mentioned to the client, we can't take them in since the insurance doesn't even allow SCA, single case agreement. Now the parent got back to me saying that by law, we have to see them. And this person was obviously, a little, I would be frazzled too if a parent said that. So, what can we do? What can we do? Let's see. Whoops. Trying to get to my tab here. Need to move this. Okay. So we can go into, we're going to try another model here to show off Perplexity. And we're going to really pretty much put that exact comment in here. All right. And this, again, has a search built into it. If you're not using a searching model, you might need to upload the document. OK, but we'll see here just with this that this should be enough. OK, so again, I put that comment in. I said research this topic relative to ABA policies for these payers in the state of California and advise how to proceed as a clinic. And you can see it's going, Perplexity went and looked at 53 sources, and then we'll get some answers here, hopefully. Based on the information provided, there's several key points to consider. United Healthcare generally covers ABA. However, as an out-of-network provider, you may face limitations. Medi-Cal covers ABA for eligible beneficiaries under 21. Let's look at the policy considerations. Let's see. California law mandates that health insurance plans must cover autism-related treatments, including ABA. This doesn't necessarily require out-of-network providers to be accepted. the surprise billing law. So you're getting all this case law. If you want to read through this, you'd be an expert, and having to go do this with Google search, you'd probably need to go look at least 10 to 15 different sites, if not, close to 50 like this one did. And so it even gives some recommendations for proceeding here. Now, what if we had a follow-up? What if this isn't really the question? Like, okay, now we know, that the parents' claim that you're legally required to see them may not be accurate, right? You can follow up with that. But let's see, what if let's assume we know, you don't have to serve that client, okay? But we want to know, let's assume we actually did serve this client. We actually have this multiple payer issue and this balance billing issue that we don't really understand. Okay, so let's assume we took that client on, and now we're having this issue. We're having this issue where the billed service amount by the private pay, the UHC, was $100, and then the allowed amount for Medicaid was only $65 for the day. Private had a 20% deductible, so they only paid $80 to us, and the patient responsibility was $20. What are we missing here? Like, why can't we recoup the full $100 given this sort of scenario? And again, because this is already in the context from above, I don't need to re-explain all that. It knows that. Okay, now if I open a new thread, it wouldn't know that. Okay, so you gotta, I think that's pretty straightforward, but it's something to be aware of. Okay, so based on this scenario, we're missing a key consideration. Let's break it down. So private insurance, it's re-summarizing my statement, basically. The total allowed amount is $165, which is the sum of the private insurance and the Medicaid allowed amount. Let's see what we're missing. The key point we're missing is that the patient may be overcharged. Here's why. So Medicaid is a secondary payer. This is what we want to see. When Medicaid's a secondary payer, it considers the lesser of the difference between its allowed amount and what the primary insurance paid. And it also it typically covers the lesser of, it compares this and sees if this difference is less, or the patient, if the patient's responsibility is less. In this case, Medicaid's potential coverage is zero because the private insurance paid more than Medicaid's allowed amount. They paid $80 when Medicaid's max coverage was only $65. So then the patient, this is the key here, the patient should not be responsible for more than the lower of the two amounts, which is $65. So because $80 already paid, you can't have the client pay that extra $20. The total patient's responsibility should be zero, not 20 or 40 as initially calculated. Okay, so it's helpful. I think you could figure this out on your own. You might already know this if you are a really experienced biller, but for a lot of BCBs, I know if I ran into this issue, this would be my number one way to go figure it out in 5 minutes rather than needing to go read all the manuals. If this failed or I still wasn't confident in this answer, yeah, then go get the manual, upload the manual here. There's a way to attach it. We can attach the document and it can read through it just like we saw before. Okay.
I had a quick question, Joshua. Are they able to build a custom GPT where they're adding to the knowledge base for future conversations?
Yeah, that's a great question.
I don't want to throw you off your order, but yeah.
Yeah, no, that's a great idea. I think one thing you can do in Claude and in OpenAI is you can do a couple different things. You can do a custom GPT, which I could show you in a second. You could also do a custom project, like if you wanted to do in payer policies. And you could put all your docs for this payer in this, kind of basket, or repository. You can add the files here just as attachments. And then anytime you chat about this, it's going to reference those automatically. So that replicates, you can do that exact same sort of functionality in custom GPTs as well. It has a nice little wizard to kind of walk you through how to build it. If you go through Explore GPTs and add one of those, you can do that. But it's just as easy to add a new project as well. Yeah, great question.
But they can do this within your system as well, right?
So within our system at Neuromnia, that is something that we offer as a upgrade. That's something that it's perfectly. You're able to do that. It doesn't in the early access model that I'll show you guys and give you guys a link to later today. That's not something that you can do by default, but that is something that we'd offer. Yeah.
Awesome.
That's a great question though. It's something maybe we'll talk to Jay about that. We'll see. Maybe we can have some custom GPTs in there. Okay, where was I here? All right, so we talked about that one. This is just a little reminder, again, why change? Why are we talking about changing our behavior here? Easier multitasking. Remember when I showed you that initial research, it took 19 minutes for it to do that. So while it's going and reading 50 sources and trying to answer your question and write you a college level report on it, you can do other things. You can, meet with your staff or call families or do the other things you've been putting off. Less errors. I mean, I think you have to review the LLM output. You need to be able to stand by everything that it produces, but it's going to read all the fine print. It's going to not get tired. It's going to make less errors over time. It's not going to be perfect, okay, but they're getting closer and closer. And then save time and money. We've already covered that. Now, the most optimal way, we talked about kind of the manual way. The most optimal way this could work, for that previous example where there's 2 pairs, and this is kind of where we're going, that's what we believe at Neuromnia especially, is, at onboarding, that an LLM agent, and I'll tell you about what that is in a second, can recognize using LLM tech that they have 2 pairs, and they can come up with rules based on that, based on the reference documents that you have, and then it can establish the correct rule set autonomously, and then build a correct amount, because as you saw in the search, it knows how to handle these situations. Okay, and so this is where we're moving. I mean, I think this is a very new idea to hand off some of these tasks that we don't really like to do, and maybe LLMs will be able to do better. Hand them off to agents with a human in the loop to help review. Real quick, what is an LLM agent? Maybe you should have put this before, but what are LLM agents? Don't worry, they're just LLMs that can generate text and use tools like coding, web browsing, or searching. Okay, so even when we saw the deep research thing go off and research for 19 minutes, or Perplexity go and look at 53 sources, those are agents already working in the background. So when you're using these tools, you're already using agents. But what I'm saying on this previous slide is there's more room for kind of specialization within our particular vertical, ABA and pediatric therapies. Okay, scenario 2, denied claims into approvals. We all know how it feels when you spent 8 hours writing a prior authorization, a treatment plan for prior auth, and then you get the this isn't medically necessary. And you met this family, that this child needs services. How do you reconcile this? How do you work on this problem with LLMs? Okay, so again, this is one of the quotes from the actual ABA Business Challenges group. They were asking, does anybody have a template for medical necessity services through Medicaid, aggression, property destruction, elopement occurring during daily living skills? The denial states it's not medically necessary due to targeting a daily living skill. Okay, so for this one, we're going to go ahead and look at Grok and show off all the models today. So this is our prompt. So we take the problem that we have and we just describe it in plain language, right? I need a medical necessity rationale appeal letter for ABA services through traditional Medicaid in Virginia. You can, obviously fill in your state, your insurance here. Tell it what's going on and tell it what the insurer said. The denial says it's not medically necessary due to targeting daily living skills. And then I think what you want to add here is also what daily living skills. So it's going to be a custom appeal letter for this individual without putting in PHI, right? You're just putting in the actual skills you're working on. And let's see what Grok does. Again, this one has a built-in web search. You didn't even need to turn on search. It's just going and looking and figuring out what's the best template, what are the requirements for a denial letter, You can go and read these websites to make sure the information's there if you don't trust it. But you can also just read this. All right, so you have all this information you can obviously fill in. You have, dear appeals department, I'm writing to formally appeal this recent denial for 10-year-old child. Now we'd want to correct this actually. So we talk about the review and the importance of review. It's confused that, that it's our child. We didn't specify this was a client we were working with as an ABA therapist. That could have been something I put in the prompt. But let's say it's not my child. It's a client on his BCBA. And we'll just, it'll fix itself. No harm done, right? So we'll get another letter. And
I have
yes.
I had one of my first college professors ever. His name was John McGill. He worked under the CEO Jack Welch of General Electric, and he used to call computers high-speed idiots. And he said, all they're going to do is what you tell them to do. They just do it really fast. And we need to treat the AI the same way. Like sometimes you got to get really specific.
Yeah, you do. The more detail you can give that's relevant, you're going to 100% of the time, you're going to get a better response than giving less detail. I mean, they are pretty smart in recognizing your intent. And that's getting better and better, so I think you do have to spell it out a lot less than you used to. But yeah, I mean, it's not going to be able to guess. If you're asking it to guess stuff, you're going to get hallucinations. If you give it the information it needs, you're going to get good responses usually. Still, though, you want to review. You want to make sure you would agree with this and you would sign your name on this. It's important. But yeah, it goes through and gives specific reasons as to why it's important to work on these things from a DSM-5 and medical necessity rationale. It talks about the diagnosis. It talks about these behaviors they're seeing, and then why it's important to provide services for this kind of individual. Okay, and even goes into citing the American Academy of Pediatrics and why it's important to provide ABA for individuals with ASD. Okay, so pretty straightforward example there, I think. And then again, the agentic LLM way. If you had an agent to monitor those auths and claims for these potential issues ahead of time, to see in your authorization, hey, this probably isn't going to meet medical necessity criteria. It doesn't have enough detail. And then it prompts you to maybe update it, and then once you submit that, it's rather than having to go in, and check availability or rely on a billing company, you can have LLM agents, monitoring these submissions, monitor via API for the pins and denials, and then even initiating the response with appeal letters autonomously, keeping you in the loop for approval. You need to review this because we need your signature, make sure everything's right for this client. But this, when the agents have access to via API to the client data, this becomes possible. And we're not really quite. That's where we're going. With in ABA, I think that's the direction we're headed with value-based care and the way that outcomes need to be tracked for reimbursement, and the way that outcomes need to be tracked just to see how effective they are and be able to compare. Give parents the ability to compare. Really, not just based on Google reviews, based on real outcomes. Like, how does this BCBA compare to this one for a 10-year-old on the spectrum? I think that when you have this level of oversight from LLMs, I think that those kinds of things will become possible finally. We have scenario 3 here, the road to compliance. So ABA compliance is a tough thing. There's a lot of boxes to check. Every insurance company has their own boxes also, so that makes it more difficult. So one of the things you can do, let's see. Yeah, when you're going ahead to, the example we're going to look at is audit proofing. So when you're going to make sure that your documents are audit proof, what you'll want to do, a lot of the ABA insurance providers have these audit checklists. And so this would be an example of something you'd want to give as a supporting reference and attach for the LLM to look at. And what we can do is provide this as context and also provide our policies and ask it, are we meeting all the audit criteria for this insurance provider? Upload another one. Are you meeting it for this? Tweak the things you need, right? So that's where we're going with this one. So I'll show you that in a sec here. Context matters, like we talked about. This is false, and you do need context. I just like this GIF, so I had to put it in. But yeah, the more context you have, like we talked about, the better. for these ABA business documents, the things that if you're going to use LLMs to help write these for your agency, really recommend having your state labor laws in a PDF that you could upload, or a project folder like we talked about. Also having the BACB ethics handbook, payer manuals and guidelines, and maybe any other policies you already have. Like you definitely want to provide this context depending on what you're asking. Then let's try it. So for this one, we'll go back to ChatGPT one last time. We can see we have this audit document. What I've done is I just downloaded this as a PDF. I've attached it right here. And then what I'm doing here is I'm taking from our initial search, well, you remember where it was. Here it was, ABA, Indiana ABA Policies Research. So from our initial research, I took what it said was needed in the handbook. Okay, this is the output. And I want to show you, what you should do to validate this if you are unsure. You can give it a payer document like we've done, and then give it what the LLM has said it needs. And then I've written the prompt: look at the handbook outlined below and ensure we will meet the audit criteria from the PDF. And we'll see how this does in real time. Shouldn't take that long because it's not doing research, it is reasoning. So you can click here and kind of follow along with what it's reasoning about, but we aren't doing like a deep research web search here. So it shouldn't be reasoning for multiple minutes. Usually maybe it's 30 seconds to a minute. Let's see, hopefully, I'll check back on this in a second. I don't want to sit here and watch.
The fact is that what it's doing in that few seconds would take you a day to go in and do all the same research. Like that's the amazing part.
Very true. That's very true. Yeah.
But we're not patient. We just want it now, all the time. But yeah,
that's right.
The amount of time that this saves is incredible.
Yeah, so you can see all the steps it's taking here. It's double checking its work. Here we go. So here below is a concise checklist of items to ensure your employee handbook meets the criteria. So it's went ahead and revised, what is necessary in your handbook. Based on the PDF requirements, this is what you need to do in your handbook. Restate your agency's mission, values, and ethical principles that guide all ABA. That wasn't in the initial, blurb that I gave it. Okay, so you're getting some very nice detailed instructions, and then what you could do is just tell it, you could copy this and just say, write this for me. I'll just stop. Yeah. And it looks like OpenAI is having a little bug here. I don't know. Maybe we're having another person using this or something right now. I'm not sure. But it's okay. So it would write this.
Hey Josh, I think you're
already, but just.
Hey Josh, I think your internet might be a little bit laggy, so you were breaking up a little bit. So okay. Start back from your last thought. Okay,
so all I was saying, I think this bugged out a little bit, so I was just moving on to the next slide, and I think we've connected these dots already with our examples, but I think just to really spell it out, how do you prompt an LLM intelligently? First off, you have to understand your problem, right? If you don't feel like you know what the issue is, we would, the first thing we recommend is ask the LLM what, like we showed you with the deep research, do that first to help define the scope. And then follow the instructions to give the LLM the right context it needs. If you don't know what to upload, you could even ask the LLM, like, what supporting documents do you need in order to write this, make it a 10 out of 10 or an A+, to make the best version of this. And it'll tell you, and then you can work together kind of as a team with it to get to that final product. And again, we've emphasized the importance of reviewing. I think you want to always review and ask for corrections, like we showed a few times. Great inputs equal great outputs, right? Garbage in, garbage out. You give it no details, you're not going to get great results. Context matters. Talked about that. Always review the work and we talked about the importance of the HIPAA compliance. These models that we've looked at today, you don't want to put any PHI in. You don't have a BAA with them, and it's not HIPAA compliant. Okay, so Q&A time. That's what we're doing now, this cute husky or Malamute. Does anybody have any questions?
Oh, I have a ton of questions. No, it's not too bad. So your system, Neuromnia, is in its own enclave within your Azure network, which is HIPAA compliant, bringing a huge value to anybody who is dealing with PHI. So you don't have to necessarily, you will have a BAA with Neuromnia.
That's right.
As their client. It is HIPAA compliant. So that just that one jump there is of huge value. You don't have to be as careful, with regulating your what's being shared with the system. So that's a huge.
Yeah, you don't have to think
point.
about it. You could put anything you wanted in ours. Yeah, so that is a huge thing. The other big thing with ours is I'd say the structure, what's going on behind the scenes. Our model has a lot of context and knowledge that we've programmed it to have about what is required for behavior plans. Like, what do BCBAs really always want to see in behavior plans based on our research? What do they want to see in the skill acquisition goal to make sure that it's always going to pass the medical necessity criteria? And our model also has payer policies and web search built in that is specific. It's going to stay gated in ABA, and it also can reference speech and OT docs. So it's gonna stay within the realm of your domain rather than be a general model and be searching for everything on the internet like these other examples that we've showed you today.
So what roles in the ABA business do you put this tool in front of? And just maybe a little example of each role and what the outcomes are as far as productivity or efficiency or accuracy on the outputs.
Yeah, let me answer that.
Go ahead, Jay.
So if you, and it depends because if you have an independent ABA provider, I would say mom and pop shop kind of provider, where somebody is wearing many hats, perhaps the owner doing also the lead BCBA, and handling billing, operations, everything. So that individual can have the vantage point across silos. So that means they, as we demonstrated, they could actually use this to be able to build a client services agreement, to having an employee handbook built, and socialize that across all their employees. So there is a solution that we've built where every document, and this is a custom chatbot that we will build for you and your respective documents, that your employees are able to search through. So that's your insurance payer contracts, your business rules, your client services agreement, your employee handbook, all of that available at your fingertips to search with. Like, the LLM will have context and be able to search through all of that. So, for example, there could be a question on, let's say, from one of your BTs about, let's say, a policy for a jury duty, if they could get a paid time off for that or not. And that's most of the time regulated by state laws and will be there in the employee handbook. If there's a question on intake about, let's say, cultural sensitivity, and that's, again, state by state, Medicaid providers will enforce that you need to have policies around that. So normally consultants would guide you through building an employee handbook or a client handbook. They obviously have that very niche of knowing what makes you audit ready. So what we are intending to build here is a true audit ready solution. That means all the documents that you will need in case of an audit will be available in one place. And I'm focusing my answer, Derek, specifically for the small business owners here, because I think that's the audience that you have. This answer will vary across for companies of various sizes. So like if you're a PBAC clinic with 8-9 centers across state lines, that's a different use case.
Yeah, it's awesome. So So tell us about the cost, for somebody who wants to bring this into their business as a tool. How is the pricing structured and what is the cost?
Yeah, so I think one of the very important vision that I share with Josh as a co-founder is we really believe that the cost of intelligence and software is going to zero, and customization is the key. So traditionally, SaaS services have priced like one size fits all, and they will say, okay, if you go to Central Reach, they're charging you $39 per client. Okay. So our intention here is to tailor the solutions based on the needs of the business owner. And let's say an audit-ready solution, like the one that I just described, that would include all your documents in one repository for you to be able to chat through. Okay, and that includes the agency document that has a price tag right now of $20 per client that you serve. And it includes everything that you have in the free version. The free version of the LLM that we are showing you right now on the screen is for you to use today to research. But what if you wanted your treatment plans to be available there, or your individual client profiles? So we'll build that for you. And the other thing that we do, which none of these SaaS companies, is we'll stand up your application as a single tenant, because we have all these different businesses. And so that means your container stays standalone, but nobody else is touching it.
It's private, it's secure.
Yes,
that's awesome.
Exactly.
Yep.
Exactly. So that's the kind of solution we're building. So you're getting access to very high-end services that would otherwise not be very affordable without generative AI. And I would say that because often smaller businesses have struggled to hire tech consultants who are very costly to build custom solutions. That's why they have to subscribe to like cookie cutters SaaS. So this
you said it's $20. I want to make sure it's clear because our audio isn't perfect here.
Per client. That's right.
Per company or per user or
per client. So if you're serving about 8 clients,
okay, per learner basically. So you're doing
per
on a learner
learner.
basis.
That's right.
Okay.
Per learner. And this was a solution that if you are looking for, let's say you just need a treatment plan and audit readiness solution, and you want to use pen and paper for your data collection, more power to you. You can do that. So everybody, I think in the small business ABA world, every owner has different requirements. And the cookie cutter nature of, let's say, Catalyst or Central is that you end up having more than you need sometimes. So we're tailoring all that based on your needs. And if this includes the RCM solution, then of course there's upsell for that. I'll stay focused on what we're offering in terms of the agency agency audit tool.
So, all right. So we've got a company. They have say 50 learners.
Mm-hmm.
So you're charging. Is that a monthly fee? Would be like per learner is monthly. So it'd be about $1,000 a month for 50 learners.
Yes, and
Okay.
all their treatment records, everything stays in a secure HIPAA-compliant manner. Not only just stored, it's at your fingertips, something that you could perhaps not have imagined before, because let's say if somebody is missing a record, you know exactly what is missing. And it'll prompt you that per the policy of such and such payer, this document is required, so you better get your hands on that document.
All right. So we're obviously going to reduce a ton of time. So that cost is going to come back to you. $20 a month per learner. You're definitely going to cover your costs there. But is there anything else? Are there any other like kind of popular solutions out there that might be able to be pushed aside and no longer used by replacing them with the Neuromnia?
Absolutely. So I think a lot of pen and paper, or say practice management solutions, there are companies out there who are not necessarily using even EHRs or practice management software. They run their business out of Excel spreadsheets. You may have known this. And for those kind of companies, it becomes an amazing tool because now you can have your Excel spreadsheets and work with our system because our agents can actually look through your Excel. So the solution that we're talking about is for those businesses that actually have a very specific way of doing things, and none of these archetype SaaS companies, their paradigm actually fits them. Now, if you say that I'm with Central Reach and I want to reduce cost, we can actually design a solution for you based on what you're actually using from Central Reach, but it'll be way cheaper because they charge you about $39. What we're not doing right now is the data collection software, which is, of course, a vertical by itself, and I believe that it will be revisited given value-based care and its priorities. So we're mostly focused on end-to-end treatment plans and anything that touches insurance. So the other part that I would like to share is a lot of people are doing this. They're actually, and this is one of the biggest pain points I've actually noticed on the site, that whether it's Central Reach or any, you can export the claims out of there, and then you're using either Office
Ally, yeah.
Office Ally or Availity to upload your own claims. And then if they get denied, then you're submitting it manually one by one. And that's a lot of time. And you may have actually hired somebody to do all of that. That entire workflow can now be automated. So what we're offering on our RCM product is the ability for you to take a spreadsheet out of wherever EHR you have and dump it on our, let's say, secure SharePoint site. And we take that spreadsheet, file your claims, and also keep you apprised about any denials of the status of the claims. And if there are any denials, we'll suggest to you what the remediation.
One more time on that last part, Jay, you broke up.
And we'll suggest to you what the remediation steps should be for making an appeal. And if it's a medical necessity appeal with a provider that is looking for a specific kind of explanation, we'll guide you through that. And that's all possible because I'm not saying we're this is all automated by the virtual chatbot that you're seeing. So you're talking to the chatbot and the AI guides you through all of that. As in real time, the AI
broke up again.
So I want to make sure that everybody understands what this pricing model actually looks like. And, if you're planning on implementing any kind of AI in your business, OpenAI going direct to them where it's not safe and it's not HIPAA compliant and you don't have a BAA is more than $20 a month. So what these guys are doing by taking that language model, which is still 4.0, it's the same thing that you're getting as far as the intelligence goes on, a direct relationship with OpenAI. As you're going through this implementation process in your business and you're weighing out different costs, take this into consideration. OpenAI directly is $20 a month ish. Yeah. These guys are charging that, but you're also getting the HIPAA compliance. So you're able to share information without, and this is something where you can much more easily implement with your team because you don't have to have policies in place that say, you can't share this kind of information. In fact, you're probably going to fail a HIPAA audit even if you have something in place like that, where you have a system like this that's even coming close. Like we all know, even if we don't share PHI on our email system, we still have to be PHI ready on those systems. Mm-hmm. Even if you're not processing PHI on your OpenAI platform, it still has to be PHI ready because of how easy it would be to accidentally share something there, right? So it's not really an option to use OpenAI directly. These guys have come up with a way where you can have this containerized system where it's just yours. It's HIPAA compliant. Only you can see your information, and the other GPTs are not learning from you. That information is not getting shared elsewhere in their system. So, extremely fair price point. Extremely important tool as we're progressing into the future here. And this is something that you can really deploy out to everybody, your RBTs, your BCBAs, your clinical directors, your policy, your compliance officer as you're building your policies out. And this is a super important tool for that source of truth, right? Where is your source of truth? Is that all in your head as the business owner, or is it somewhere where everybody can access it without calling you and come to you with problems? This is scalability, right? So I had one other quick question. What are you guys doing about, like, we have a lot of RBTs that are doing in-home service. That source of truth is important to get that out to the RBT where it's in their pocket. So them having that availability in the form of a mobile device app, is that something that's coming soon or already available?
Absolutely. You touched on the right point. We right now have our chatbot accessible to the browser. So, and we're definitely going to bring up a mobile app that will do the same. So the chatbot access.
This is how it looks.
Yeah.
It's very functional on mobile.
Yeah, this is your boss in a pocket, in your pocket, right? Your boss is in your pocket. Right. We're taking that, and when we set up a governance, risk, and compliance plan for a business, it's all about managing those policies, keeping track of it all, keeping track of your procedures and compliance changes, making sure that all that is straight. That with this is an amazing way to make sure that your source of truth is centralized, that things are maintained and up to date, and making it available to your team. Right. And this is you micromanaging your business intelligently, right down to the delivery method that the RBT or BT, if you're in a state that allows that, doing their in-home services. It puts you in their pocket where you're micromanaging without having to micromanage all the time. So right now it's in the browser. That's easy enough to use. I was using ChatGPT on my browser for a while until they came out with the phone app. But this is immediately something that you can do to improve your business, reduce your workload as the owner, and really get those specific guidelines adhered to quickly, and giving your people a source of truth that's not you. We often have a situation where we've got the business owner and they're sharing that responsibility of the source of truth. Right. So how do I do this? How do I do that? What do I do in this situation? If you're the source of truth, that's why your phone's blowing up all the time. And that's why you can't scale your business. Some of us have those superstar employees that we kind of share that responsibility with, so we can step out and go on vacation. It's solutions like this that take that entire responsibility set and remove it from people in your business and put it in that centralized spot where everybody can access it who should be able to access it, and only those people. But really putting that out there where you're moving your policies and your decisions as a business owner, how you're going to do things, why you do them that way, putting it right in the pocket of your employees. This is an amazing way to do that, especially for $20 a month. That's just like a huge relationship improvement between your company and your clients for $20 a month each. That's a steal.
Yeah, absolutely. Very well said, Derek. And I'd also like to highlight the value that you get out of that. So our pilots have shown that on an average, clinics are saving 70 plus hours, admin hours in a month. So, in a week. So that means you're actually doing two people's work if you add both the RCM and the audit due diligence part that I shared. Attrition, churn, and RBT support is a big pain point in the industry today. And we believe that by empowering BTs to have information at their fingertips, whether it's treatment plan related or the program that they're particularly running, or even examples, assistant, like this actually overlaps a little bit on the clinical side, where there's a gray area, I believe, where the BCBAs can come. But I believe the day is not far where remote supervision or virtual supervision for BTs will be a reality. There's a very interesting number that actually that 30% of claims today across the board are being denied. Okay, that's actually whether it's PE or independent contract, and that's actually the highest in healthcare. The ABA number for denial is 30%, and out of that 30%, 65% of claims do not get resubmitted. So just by the virtue of dropping your denials to from let's say 30% to under 5%, you're putting in your pocket per client $18,000 annually. Okay, and that's possible because we have the AI scrubbing your claims for issues that no rules-based system right now will do because they're programmed in one point in time. They don't look up, go search the internet and find the latest pair rules.
So what is
your free? Yeah.
Okay.
They don't have yeah, go ahead. Sorry.
Go ahead. There's a lag.
Go ahead. So they don't have the ability to look into your insurance contracts that you have with your respective payers to know exactly what requirements exist, or and why, if there's actually that many hours that are still available as authorized for you to bill. So there's a layer right between availability or the clearinghouse and your EHR. That's the gap where we fill in to bring your denial rates from anywhere from 30 to 25% down to less than 5%. And that's money in your pocket. So all of this, we're selling the entire clinic solution per client for $20. So I can't talk much about the value, and this is the value that we're ready to provide as a startup because we're starting off. I don't know whether in a year's time we'll be able to keep that price tag promise or not. But for our initial customers and for the ones that would like to use us in 2025, we're definitely offering that.
Yeah, so get in now while you can. There's a lot of solutions that we have in IT where other IT providers find out what we're paying for something and they're shocked and they're like, how did you get that? I'm like, because we've been using them for 11 years, right? And they're like, they only started about 11 and a half years ago. So you get in early with these companies as they're developing and you get two great benefits. One is the cost, right? Being a long-term customer. Two is that feedback that you can give to those small developers, those small organizations as they're building this. And I know you guys are concerned deeply about the usability of your product. And I know that you guys are going to take those development suggestions to heart immediately and add them to the system. So get in while this system is being built and start enjoying the benefits of it. And it's only going to get better from there. So I've worked a little bit over time, but I just wanted to thank you guys for all of your hard work on this. This is a game changer for the ABA industry. Your free version, you said you have a free version, or is
yes.
that just okay?
Yeah.
So tell us about the free version, what we can use, because I know in the context of a lot of our startups, they're going to want to start using this to build policies, procedures, things like that. So what does that program look like?
Josh, go ahead.
Yeah, so that's what I've been showing off in the background as we go ahead here, as we've been discussing this last 15 minutes or so. This is the early access version that you can access now for free. Again, this won't always this may not be something we always offer for free. I think we'll at least offer a limited version, but right now this is unlimited. There's not any gates or rate limits or 10 messages per hour sort of things. We want people to use it, and yeah, I think we have great solutions for people that want to go beyond this. But this is what you've seen today is what you could expect. Yeah, and you can just sign up now. It's just
I just did it.
Oh,
I just went
Perfect.
to the link. It's
yeah, that's niachat.com actually right here.
niachat.com. I just went. I signed up. I'm in the browser. Like I'm already in.
So the tool right now, Derek, is focused predominantly primarily focused on BCBAs and clinical front work that a lot of BCBAs do for, let's say, writing programs or treatment plans. And there's a lot of writing that they can avoid. So we've been noting that 4 hours of writing can be reduced to under 30 minutes with what we offer. So let's say you were writing skill acquisition goals, behavior intervention plans, caregiver plans. Even if you have like SOAP notes that you want written in the format that insurance audit requirements will be met. All of that could be had in the chatbot for free today. Okay, you might search the web for payer-specific rules and requirements. That's also available. And the chatbot actually understands RCM, or if not as well as an RCM vendor or consultant, but pretty close to guide you about situations that we demonstrated, like multi-payer situations.
And can they get a BAA from you guys on the free version?
Yes.
Okay.
Yeah, so the BAA is included in the free version. When you sign up, we make you sign the BAA digitally.
Yeah. Okay. Well, this is amazing, and everybody who's watching this video needs to go at least try it out. We've seen it demonstrated. They're giving you open access to check it out and use it yourself. So really amazing, guys. Like I said, a game changer. And go to NIA, N-I-A chat.com. It's right here in the bottom left-hand corner of the screen. And it's really an amazing adaptation of an existing technology that's been focused in like a laser on the BCBA and BT role at your organization. So get in there, use it, and remember, it will only do what you tell it to do. So we'll do some more information on prompts. We'll have some follow-up stuff like on kind of how to use AI in general, and that'll be probably a little more helpful because you need to be equipped to learn how to use this tool. But the best way to do it is just get out there and start using it. Put it in front of your employees. Let some people test some stuff out and experiment with it, and see if this is something that I know if you put the time into learning how to use this system. It's addictive, right? You get into it a little bit and you're going to be, just using it all the time. Just like he said, Google, right? We all had to learn how to do Google searches. Now we got to learn how to do prompts. Otherwise, you're going to get left in the dust by your competitors, right? Their overhead, this is going to lower their overhead costs. It's going to help to retain their employees. And you're going to have this really cool tool that not everybody has, right? Like we use AI. I'm going to make your job easier, make your work environment better, reduce your staffing costs, bring down your turnover rate for your people that are doing this brainless kind of work that burns everybody out, right? So this is a great tool for that. I would say anytime you can move 1%, move your business forward 1%. Make that little bit of progress. And this type of solution is far more than 1%. This is definitely something you can get way farther down the road than that normal 1% thing. So, but both of you guys, really thank you for your time. Jay,
Thank you.
Joshua,
Thank you so much,
and we'll do this again soon. I'm excited. I'm logged in. I'm going to start using this thing. So
awesome, Derek. No, that's a great shout out. And feel free to reach out to us, Josh and I. We're just an email away, and we're happy to walk you through the system.
If you have any feedback, you can easily give it here too.
Awesome. Awesome. Thanks, guys. We'll see you on the next one. Bye, everybody.
Thank you so much, guys.
You're already doing the work, investing your time, your energy, and your vision. So let's make it count. Build something that works without breaking you. The EBCBA Blueprint is the way. Get started for free with our foundation course.